The next speaker is Jennifer Murithi from Kenya. We have her video. About 8 years ago, tragically, her predecessor died. She was a close friend of Jennifer's, and Jennifer stepped in and got special training and has given splendid leadership in the years ahead. She has a massive program aiding persons on HIV and AIDS, and she does it with great competency, accountability, and transparency. I can't tell you how important it is to have really verifiable partners on the ground, people of integrity and faith and vision. And so, Jennifer, we thank you, and as we look at your video at this time.
Hello, everyone. My name is Jennifer Murithi. I'm in charge of HIV and AIDS program. In this program, I don't work alone. We have the bishop, who is our immediate supervisor, and 3 social workers, and 53 community volunteers who assist us within the communities. In this program, we have 361 orphans and vulnerable children and 35 supporting groups. In the supporting groups, they meet once or twice a month. This is where they socialize and encourage one another. And that is where we chip in as staff members, the bishop and the other staff members in the office. We encourage them, we socialize, we read the Bible, and they do many other things to see that they stand and continue taking their drugs. We had relief food exercise. In this exercise, we gave food to all the caregivers who we divided into groups. We call them clusters. In this cluster, we did this to shorten their distance, cut the transport that they could have used, and also try to keep distance, especially this time of COVID-19. We did well. We visited all of them, and we made sure the 361 families have food. In this exercise, we met a family who had slept without food, and they could not continue taking their drugs. They all take the drugs, and due to lack of food, they could not take the previous days. But we encouraged her and made sure that with the food we have given, they will continue taking their drugs so as to remain healthy. During the exercise, we also had time to talk to all the caregivers, to the side of OVCs, to take care of them, the orphans and the vulnerable children, to take care of them at this time that they are at home, to make sure that they continue learning and continue staying at home to be safe. In this program also we have the street program. We have street families, and we are happy to report we have 9 children in school from the streets in different schools, where we take care of them through food, the clothing, and the tuition fees, and anything that they need to remain in school. We usually give all the street children food. We call them together, share the food, cook for them and share together, and they have time to rejoice. And we tap their talents. They have their talents, although they are in the streets. And with this program, this far, we are happy because we have been able to meet all the groups, including the disability groups, and the vulnerable, the widows and the widowers, and all those who are vulnerable and in need of our support. Thank you so much for continuing with us. God bless you.
Thank you very much for that presentation and for the tireless efforts that you have expended in the past months to deliver food. It's one thing for us to present funds and raise funds here to give to you, but you have to go out and buy the food, you have to organize it, you have to bag it, you have to uh, get volunteers on the ground, and it's a lot of hard work and some danger as you face COVID-19 yourself. So, Jennifer, we appreciate your work along with your colleagues there as we together feel that we're in partnership working to overcome hunger and HIV and AIDS in our world.